Hello and welcome to the PDG B5 TA Center webinar on coordinating funds to support the sustainability of comprehensive early childhood systems. Before we get started, there are a couple of housekeeping items to review. Please use the Zoom chat feature for comments, reactions, and links. You can also use the Zoom Q&A to ask any questions at any time during today's webinar. These are the webinar objectives for today, and those objectives are to understand the goals and results of coordinated funding, share strategies, examples, and resources to assist state and local leaders with coordinated funding, and lastly, share lessons learned regarding successfully coordinating funding. Now I'm going to pass it to Lori Connors-Cadros from the National Institute for Early Education Research.
Thank you, Sierra. Welcome, everybody. For those on the West Coast, good morning. For those on the East and in the middle of the country, kind of afternoon and early afternoon, we're very, very excited to have you. We had over 500 people sign up for the webinar. I think they possibly thought we were giving away money, but we are going to be sharing some very exciting and important strategies and lessons learned about how to coordinate funds. Today, we're going to share with you 7 policy strategies that can support the sustainability of programs and services in your early childhood systems. By and large, these are not strategies that use new money, but leverage and maximize funding sources that may be time limited or may have similar eligibility requirements in order to serve more children or provide more comprehensive services. The strategies that we share in the brief and that we'll be featuring today are all drawn from the incredible work of PDG B5 grantees. As someone who's been in this field for a long time and working on financing and sustainability for almost more than 20 years, I think that the federal folks can be proud of the fact that federal dollars really have helped to support states in expanding services for young children. They've been used in very innovative and capacity building ways, and we're going to share more about that. I mean, as you know, and I know you face every day, most early childhood leaders do not typically have sufficient resources to fund programs with one funding source. So coordinating funds is more or less a given of our work. Often you're leveraging local, state, and federal resources and putting this all together in a pretty complicated puzzle. So we applaud you. We know it's hard work, and we know that we have a lot to learn from each other, but there's a lot of great things happening across the country that we're excited to share with you today. So I'm going to begin. The way the session will go, it is an hour. We'll end promptly at 4 Eastern. I'll talk a little bit about the definition of blending, braiding, and layering and how we're using it as a coordinating funds as an umbrella term. We'll describe these 7 kind of policy strategies and give you some examples. And then we're going to hear directly from Rhode Island, Minnesota, and Washington State about what they've done and, most importantly, what they've learned. And I think that will be really, really, really exciting for us. So we use these terms, and I'm using the term coordinated funds as the umbrella for blended, braided, and layering. Blending and braiding are rather popular terms in the field, and they're primarily distinguished by their level of accountability. So in blending, typically you are allowed to more or less commingle the funds, not necessarily supplant the funds, but you don't necessarily have to track them in a separate accounting system. And of course, that makes things a little bit easier. And layering really came about with early Head Start, in that the feds allowed layering different funds in order to provide more comprehensive services, and in particular meet the needs of certain certain children. So the first layer is the kind of basic funding, I'm going to say, for childcare. The second funding might layer services to provide home visiting or family support or whatever. And the third layer might be for those with specific identified needs, I'm going to say special needs for now, that for those children that need more comprehensive services. So as it's very important when you're determining what you're going to do and how and what strategy you're going to use, that policy folks sit with their fiscal folks and legal folks potentially, and ensure you have the right internal controls and accounting for these funds. This is a powerful financing strategy to coordinate funds, but obviously we want to still be accountable for them. And most likely the various funding sources and will require that of you. So very quickly. As I said, coordinating funds is often, these are two very large goals. Typical goals are to increase efficiency. You can reduce some administrative burden, a duplication of reporting. You can allow dollars to be used more flexibly. It's really a great tool for redirecting and or leveraging dollars towards kind of the priority goals that you want to meet and possibly the priority populations you want to meet. It can either increase the sustainability of funding to support the continuation of funds, because funding cycles are so different. Sometimes certain funds might be a glue until a next funding cycle comes about, or for the period of time you're able to provide more comprehensive services. I'm sure each of you have your own reasons for coordinating funds. And it was an explicit goal of the PDGB5 to use resources efficiently, and to maximize and leverage resources so that they were going towards the most vulnerable children. I think that the coordination of funds, and especially when I talk about the different strategies, if you think about holistically as a framework, they can serve to create a more seamless system and easier access for parents or families and even providers. So depending on your own programmatic priorities, you may employ a range of strategies to coordinate funds, and that'll kind of depend on the use and the restrictions or requirements of the funds. So as I was reading the annual performance reports and looking at the field and what is reported about financing and coordinated funds, I identified 7 policy options, and I'm going to go through them each one by one, but I hope you think of them as a framework and a comprehensive set of strategies that a state could use within a strategic financing plan that both kind of primes the pump for coordinating funds, and or provides you with data to secure new funds. And you'll see some of that as we go along. So one important caveat, I suppose, in coordinating funds is that there's certain funds that could be coordinated at the state level because the state has some control over them, like CCDF, for example, or state-funded pre-K. But there's other funds that go directly to locals, like Title I or Head Start. So part of what the work is in developing these financing strategies is also building local capacity to more efficiently use resources. And a number of states, Oregon, Louisiana, West Virginia, and others, are implementing kind of local coordinating organizations. And in some cases, they're giving them the some fiscal authority and fiscal opportunity to leverage funds. Probably one of the best examples we have in a statewide model is the West Virginia pre-K, which has a shared governance at the state level. They put together like IDA funds, for example, with the state pre-K dollars at the state level. And then at the county collaborative level, they are required to both do a coordinated enrollment and then to determine how they would leverage other local funds in order to fund quality classrooms in a mixed delivery system. And other examples are in New York State. They developed, guides for blending and braiding specifically for childcare and home visiting. But more importantly, they developed a trainer so that for the local R&Rs to help programs understand how to do it, to ensure that they were meeting the fiscal requirements. We often say blend and braid, just blend and braid. And there's a certain amount of capacity, both administrative capacity and facility with, financing and tracking dollars that's needed in order to do that well. As I mentioned, these are very interrelated. So the second policy option is blending funds at the state level to be distributed locally. And both Minnesota and Rhode Island are going to speak about some examples of that. But in essence, it's a kind of a pooled fund, but the state takes on the burden, if you will, or the administrative effort to pool funds, typically from federal and state sources, and then create this fund to offer, whether it's competitively or not, to local folks for specific services. So the third option is aligning goals, regulations, and standards. And this is a kind of a necessary foundational first step. You can't really blend or coordinate funds if particularly their eligibility requirements are not similar or in some alignment, and that their goals are for similar kinds of purposes or can be encompassed within whatever you're planning to fund. Lots of states are now really looking to coordinate eligibility and enrollment, and this is an incredibly powerful tool. And it almost encompasses probably 3 or 4 of our policy options, because in order to coordinate eligibility and enrollment, you have to align goals, you have to understand eligibility and regulations, you have to have data. And you use that data to then say, within a community, here's the capacity we might have to serve X children, and how can we best utilize that capacity, those funding sources, to more or less get the most bang for our buck without competing with each other. And that's a very powerful tool. I know a number of states, South Carolina, Michigan, and others are exploring that option, and it takes some time to put that together. There was sorry, just one second. Okay. A number of other states have put together, Washington State, and Lindsay might speak about this in a minute, but more or less a coordination plan, which at its highest level just lays out the different programs serving what ages and what eligibility and where perhaps. But that allows you to potentially see opportunities to coordinate funds. And sometimes, because the nature of our work in early childhood is, sometimes siloed within an agency or a program, you don't even know what the opportunities are unless you really do some of this, cross-hatching kind of work to really understand the system. This is where fiscal mapping, which I'll speak about in a minute, often comes in as well. The state of Colorado, in part of their PDGB5, developed a couple of very powerful tools or matrices to really just identify areas for greater program alignment and identify opportunities. This is in the brief. You have links to them. There's a provider operations matrix that identifies some of the regulations, requirements, and operational elements. And then there's a family access matrix. So those tools can be really helpful as part of your toolkit, if you will, and set of strategies to more effectively coordinate the resources that you have and leverage them. As some of you know, I'm a big proponent of sustainability planning. I know you all had to put a sustainability plan when you access the PDGB5 funds. Some of you participated in our work group, but really the minute you kind of get time limited funds, you really need to start planning for how you're going to sustain them and in what way. I mean, I put here kind of there's a plan, do, review approach to sustainability planning. Often you get the funds, you plan how you're going to use it, you do it, and then you start reviewing what the impact is, what the fiscal resources are needed. And Amanda will speak. That's going to be one of her examples. It's the very intentional way that they took on sustainability planning for time limited funds. Now you can do that for your whole set of PDGB5 activities, some of which I know intentionally don't intend to be sustained, or you can do for just the investments you made that were like perhaps on direct services, which I think Kayla will speak about in a minute as well. Another really powerful strategy is to use time-limited funds to pilot innovations so that you can get some data on how to sustain or scale it. And a number of states have, PDGB5 states use that piloting option in order to get the data to then advocate for state funding. So for example, in Alabama, use the PDG funding in combination with state funds to pilot a strategy to expand the quality standards of the state's first-class pre-K for infants and toddlers. And that's called the First Class B5 Foundation Program. They collected data and then they expanded to 15 classrooms, and the state's committed CCDF dollars now to sustain it because they found it was effective. And Washington State will also speak in a few minutes about a similar effort to pilot an expansion of their pre-K program with infants and toddlers, and then use that data from the pilot in order to secure sustainable funds. The sixth policy option is consolidating or aligning governance and authority. I mean, finance and governance are inextricably linked in terms of defining who has fiscal authority and accountability over funds. A number of states that I'm sure you're aware of are either consolidating programs and funds in one agency. A recent example is Virginia. Louisiana has done so. Michigan as well, where childcare dollars, Head Start dollars, other dollars serving young children and their families are all in one agency, with the goal of greater efficiency, greater opportunity to coordinate funds and do that kind of pooling at the state level, and to kind of leverage and maximize the various funding streams that can be used for young children. I think you also know New Mexico, which has had an amazing trajectory, really, actually, in advocating for a separate Department of Early Care and Education, and in securing funding in the recent election from the land grant dollars. That they really are kind of in a great position because programs are within one agency in a coherent framework with some sufficient resources. And Colorado is in a similar position as well, just having launched their new agency. It doesn't have to be a new agency, and there are certainly definitely ways to coordinate and align governance. A lot of early learning advisory councils do that, and others as well. And then the seventh policy option is collecting cost and revenue information to include in your data systems. Why do you need this? Part of the reason one is to know who is being served and how many, And that helps you determine what the cost is and what kind of funds you might be able to use, but also to collect data over time about how efficient, whether the funds are being used efficiently and accountably and achieving the outcomes that you want. I know states are in various places of developing a robust data system, an integrated data system, but including fiscal data is really important in order to make good policy decisions as well. A number of states are doing cost modeling and fiscal mapping. This kind of data is really important to understand where are the dollars and where are they going, and what could be coordinated or leveraged in another way to better align with your goal. And some states, I would say that Illinois is a very good example. They've had for a number of years a risk and reach report that's produced by the Erickson Institute that basically shows where the money is going and the programs are being served relative to the risk of children and families. And then they recently did a fiscal scan to kind of match with that. So that's great data to be used for decision making. These are the 7 policy options that you can consider. I would say that as you think strategically about your financing and your opportunities to coordinate and leverage funding, to consider one or more of them. Often they are interchangeable or they build on each other, and they are kind of interdependent, if you will, in being able to meet the needs of children and families. There's lots of information in the brief, and I don't know, Sierra, you can make sure that's in the chat. I think everybody did get it when they registered or shortly after, but and I'm sure there are many other examples. I'm going to take a pause for a minute and Sierra, see if are there any questions that we want to answer right now.
Hi, Lori. No questions right now. We've been answering questions about if the slides will be available.
Okay, that'd be great. But that does remind me that you can post questions as our 3 state speakers or anything else that might come up right now, you know, based on what I said and what they're going to say. Do go ahead and post those in the Q&A, and we'll either intersperse them as relevant through the rest of the presentation, or we're going to keep time at the end. And we really do want to hear your questions and what you might be proud of in your state that you've done in terms of coordinating funds, and what you might be struggling with, because we know that this is a complicated process, and one that that we are dealing with every day in early childhood. So, as we reflected on the data and the lessons learned and the sharing of the PDG B5 grantees who, are some of the really innovators and leaders in coordinated funding and using funding wisely, we came away with these kind of takeaways, if you will. Intentionally embedding new programs in existing program infrastructure basically allows you to leverage the program infrastructure and not create a whole new set of costs, especially when it's a new program and you're determining, whether you're going to use it and what the scale is going to be. There's probably lots of blending and braiding occurring within communities that the state may or may not be aware of. And it would be a fantastic project to just support local entities in doing so, and then collecting data on the efficacy and the impact of coordinated funds. Lots of times new ideas occur and are incubated, if you will, at the local level. So those states that have an infrastructure around a regional collaborative or whatever you might want to call it, they have, those are lots of naturally occurring experiments and lessons learned that the state can utilize. Really examining regulations and restrictions on funds. frequently folks have an idea that a fund can or cannot be used in a certain way that may or may not be correct, may not actually be embedded in a regulation. And it may be an area that you've determined is really a high priority and you want to get changed, and you have the opportunity to do that, whether it might be through legislation or through rule or regulation. And that kind of leads to the next one. Sometimes waivers or changes in regulation or policy might be needed. And sometimes you may use a waiver for something that you're trying out before you do a wide-scale change in rule or regulation. You might pilot new ways of coordinating funds to meet an identified need, and developing a consolidated project plan and budget that accounts for all funds. In a way, this builds on what we previously said about looking at kind of the costs, the cost from a cost modeling study, fiscal mapping that might identify funding sources, and putting that together with the goals you're trying to achieve, and that helps you ensure that the funds are going where your priorities are. So we hope that is helpful as a way to kind of sum up an overview of strategies to coordinate funds to sustain comprehensive early childhood programs. So I'm very excited now to have guests from 3 of our PDG B5 grantees and your colleagues. So they will share what they did from Rhode Island, Minnesota, and Washington State. Well, then we'll have a little discussion about what they've learned, what data they've been collecting, and how that might impact some of the work they're currently and doing now and in the future. So I'm excited to welcome Kayla Rosen, who's the Director of Early Childhood Strategy in the Rhode Island Office of the Governor. Kayla?
Thanks so much, Lori. Hi.
You just slipped to mute, Kayla.
Am I unmuted?
Yes.
Great. For some reason, it kept muting me. Hi, everyone. I'm so excited to share what is happening in Rhode Island. And while I'm sharing today, it's obviously the efforts of many people in state government who have made these types of initiatives happen. So the first one we wanted to share is regarding Rhode Island's health equity zones, which I think is a strong example of that policy option number 1 of building strength and efficacy at the local level to drive more kind of ground up and community driven efforts. So through the health equity zones, what we've done is braided and layered funding from several sources to support community health equity plans. So we ask backbone organizations in different physical locations in the state who have kind of a catchment area to identify key health equity needs for their community. And then we, through braided and layered funding, support those plans to make sure that we're driving health equity in a really local and community driven way. We actually were able to layer PDG B5 funds through the health equity zones and ran parent support, parent engagement, parent knowledge programs through the HESs, identifying where can we be most effective in being culturally responsive and really meeting the needs of particular communities. And so this led to things like incredible years. We had parent navigation programs, really at the kind of ground level, which was only possible through this braiding and blending of funds. The second example is our pre-kindergarten program. Like many of you, we have a state pre-K program. We are at 2,300 seats, which I realize in other states sounds very small, but for us is about 18% of our little kid population. And so we are, or of our 4-year-olds. And so we're trying to expand the number of seats in the state. And we're doing that by layering funding across our state pre-K categorical, Head Start funds, CCAP, and we've been able to use PDG for this as well. I can throw it into the chat, but examples of how we've been able to layer funds. We are thinking about pre-K as a quality offering within the mixed delivery system. So we started with the shared goal of where is quality childcare happening and how can we support and improve the quality of that early learning to meet our Rhode Island pre-K standards and making those strategic investments across the mixed delivery system to support people in reaching, the different standards. So whether that was extending the length of the day or the time of the year for Head Start, whether it was, bringing in quality supports and increased compensation for childcare centers, it's really using our existing infrastructure and almost matching the right fund stream to reach a shared goal. One of our directors in the past used to joke that it's almost like being a chef in the kitchen. Like, you don't want to see how it's made. We'll take care of that, but we'll give you the very nice dish on the other side. So there's a little bit of us trying to figure it out at the state level, but from a provider perspective, from a family perspective, what they're receiving is a really streamlined and equitable approach across the mixed delivery system. So I'll put that link into the chat so folks can see a little bit more detail on how we are layering different funds, because it's a little nitty gritty, but happy to take questions in the next section.
Thank you. I thought, you really honed in on a couple of points that I thought were really important that I don't think I mentioned. But, deciding how to use funds is best, that decision is often best made at the local level. And I appreciated what you said, particularly around the health equity zones, where you really engaged with families and finding out what they needed. That was a really, and that it was kind of more culturally responsive and responsive to the needs of the community, that you were able to do that. And secondly, I think you were a great example of, the state taking on as much burden as it can in terms of putting funds together so that locals can go out and do the work. So thanks, Kayla, really appreciate that. Those funding models, I think, are really important and great resource for other folks. I know there was one also that was using IDA funds and the state pre-K in order to expand access for children with special needs, which is really important as well. Alrighty, let me hold on one sec. And we're going to come back and have a discussion. So the 3 states will share more or less what they've done, and then we're going to have a deeper discussion about what they've learned. Alrighty, so we have Amanda Varley, who is the Preschool Development Grant Manager at the Minnesota Department of Education, who will share what they've done in Minnesota.
Great, thank you, Lori. And just to contextualize the preschool development grant in Minnesota, Minnesota Department of Education is the recipient of the grant, but then it's a partnership between our departments of education, health, human services, as well as our children's cabinet. So I'm going to focus my comments on 2 of the policy options Lori highlighted. The second policy option, which is blending funds at the state level to be distributed locally. And then the 4th one, which is planning for sustainability of time-limited funds. So for policy option number 2 about the braiding of funds, we braided federal preschool development grant funds with state funding to make local grants. So in Minnesota's in our initial planning grant, we did community engagement all throughout the state, as many of you did, and talked to over 1,000 folks from all 11 tribal nations in many languages. And of course, heard a lot about the needs for increased access to services and quality and streamlining systems. But another theme that I wasn't necessarily expecting that we heard is that communities really have the solutions to the challenges that they want to solve, and that the state should make direct investments in communities to solve those challenges. And so that came across in our needs assessment and strategic plan. And just as we were writing our renewal grant, these grants were passed at the state level, called the Community Solutions for Healthy Child Development Grants. And they were awarded, through our state legislature, they were granted to, or the Center for Health Equity at our Minnesota Department of Health was identified as the grant administrator for those grants. And so the timing was pretty perfect. The purpose of those grants were to be awarded to community-based organizations to improve child development outcomes related to the well-being of children of color and Native American children from prenatal to grade 3. And so we were able to partner with our new colleagues at the Department of Health who are working on this, who we had not partnered with before, and got to say that wonderful thing of what do you think of having more funds for this wonderful thing that just passed? And they were really excited. And so just like how it came about is that we have an interagency contract between education and health that we take money from education with our preschool development grant, braid it with their funds at the Department of Health, and then they administer the grant. And so a few wonderful things have happened from this. One is that they have a community advisory board that leads the entire RFP process. So they have developed the RFP, they solicited grantees, they awarded them, they continue to support them. So we benefited from having community voice throughout the entire process. We also had the ability to have shared administration, and we didn't need to develop a new grant program as a part of the preschool development grant, nor do community organizations need to apply to another grant program. And then the preschool development grant was able to add some additional supports through our evaluation, our communication supports, sustainability planning, community engagement, to add more, to spotlight that grant program more and to add more support and be able to tell that story better. We also have been able, since they were doing such a great job with equity and grant making and making great strides there, we were, in the preschool development grant, brought it across agencies, as we've been able to really highlight those best practices across state agencies and get it more embedded in how we do the work. And also partner with our Department of Administration, who's the main body that oversees grants for the entire state enterprise. So just sharing some of the benefits of braiding those funds, especially across state agencies in our case. And then just to briefly talk about sustainability, is about a year ago, maybe even over a year ago, we went into a long process, a 1.5-year process about sustainability planning, and it was in the middle of our current renewal grant. And mostly what I want to highlight about it is that funding, of course, is one extremely important lever for sustainability, but making sure that it works in tandem with many of the other levers that are key to sustainability. And so in Minnesota, we found 7 levers for sustainability, one, of course, being funding, but then we also need strong support, whether that's champions or public will, but making sure that we have that support throughout to make sure that there's support to continue to sustain things. Also making sure that we have, like Lori talked about, that really strong organizational governance. And so for Minnesota, we're lucky to have a very robust children's cabinet that's co-chaired by both the governor and the lieutenant governor, and has the commissioners from nearly all state agencies, that they are well attuned to the preschool development grant work and are aligned on these efforts. And then making sure that we have management systems. And so some of the challenges that we can talk about a little bit later too are, the fiscal management of how do you braid and track multiple funding streams, the grant programs, and how do we make sure that we have those policies aligned. So making sure that we have management systems as well as those program rules that are aligned, that enable the coordination of funds and sustainability, as well as staff and expertise. When we do this work, it's easy to talk about the program staff being mission aligned in this, but how are we also balancing that with fiscal staff and grant staff, and also separately HR and IT and all of these staff that support our organizational and how it operates, to be committed to doing work differently than how we have been, and the culture shift that goes with that. And then finally, adaptability to leadership changes. And so is a key part of sustainability and this long-term coordinating of funds both. So I was just at the beginning of this, when we were talking beforehand, talking about how we will be maintaining our governor. Our governor won election 2 weeks ago, but we just heard this morning or yesterday that both the commissioners of health and education are not going to be continuing in the second term. So how do we continue the momentum and have systems in place that can withstand any leadership changes? But so that's perhaps a bit of a tangent on how coordinating funding, but how it relates to sustainability, and just thankful for this conversation and for everything Preschool Development Grant has done.
Thank you. I don't think it was at all a tangent, because you know, part of the sustainability planning approach that we use, and by the way, these materials and information are also on the PDGB5 website. We have a pretty robust planning tool, you know, include the monetary and the non-monetary resources that and strategies that allow you to build a comprehensive system and sustain and sustain it and strengthen it. And I really appreciated you mentioning kind of the leadership changes, because that's, you know, that's just part of the nature of our work. And being able to adapt to that, but having that guide that they have, and when you take a look at it, it's pretty impressive, because that gives to the new, whether it's the new governor or the new commissioner, this is the will, if you will, this is the, you know, this is the perspectives of all these community members that were involved in various different ways, and plus state agency folks. So really great to have it written like that you could share, which it doesn't always happen as well. So thanks so much, Amanda, and her team and the folks that worked on that are, you know, been so gracious in sharing their approach with others. So that's a good resource for you all. So now we're really excited to have Lindsay Lasher, who is a grant specialist, a senior grant specialist in the early learning division at the Washington State Department of Children, Youth, and Families, and talk a little bit about the way, these are really just a couple of the ways that they are using a coordinated funding strategy. So, Lindsay?
Hello. I work for Department of Children, Youth, and Families, which is a state agency within Washington State that focuses on early learning and child welfare. In 2018, child welfare and early learning merged to form one agency to hopefully integrate our early learning and child welfare systems. And that was right around the same time that we were awarded the first year of the PDG grant. And so the last couple of years, we've really been focusing on policy option number 3, aligning the goals and regulations and standards, as Lori mentioned. And our main thing that came out of our needs assessment that we did back in 2019 was we heard from a lot of people that across our state that they really needed support, and just on multiple levels, whether it was financial or even just structure. And so we really focused the last couple of years in developing our early learning coordination plan, which was developed with in collaboration with our early learning leaders across the state, with the emphasis on removing barriers in our system for those most marginalized, reducing duplication of the efforts in funding, and streamlining policy requests to our legislature and at a local level. And then this formed what we are considering now our core network, or our steering committee. And we have legislative members, advocates, and providers, all connected across our state through our early learning coordination plan. And we are using our early learning coordination plan as a tool to request legislation. Our legislative cycle begins in January, and so we have used our early learning coordination plan as a tool in developing our decision packages to our request to our legislators. And using this plan, I feel like I'm saying the word plan a lot. We have really brought everybody that's essential in our system together, so everyone can hear about what is happening and kind of collaborate together to be able to make decisions. And we've actually done this internally as well. So we have an internal PDG group that has come together. And so we try and foster our efforts there. And then we also have our steering committee, as I mentioned. And I will share our early learning coordination plan in the chat when I'm done. Right now it's housed on one of our communities, our Washington State Communities for Children website, because we don't have our website up and running yet, but we are in the works of it, and we're going to develop a whole bunch of tools that people can utilize as well. And so, but for now it is there, but just know that our website is coming. The second option that we have focused on was option number 5, using time-limited funds to pilot innovations. And we use that within our pilot for our early learning education assistance program for 0 to 3. And it's basically our state version of early Head Start. And we utilize evaluative efforts by our PDG evaluation team, where they use implementation science to be able to tell a really powerful story behind early ECAP and its early successes within our pilot. And then they developed a very extensive report that we provided to the legislature back in 2020, I believe. But it really allowed for us to tell a really great story that our state legislature then was able to provide $3.5 million to continue on alongside our PDG efforts for this program. And our evaluation team, they used data gathered through the pilot through listening sessions, data from contractors, and then data that we already have in our system. And I think that is it for now. All of this was basically stuff that we kept hearing from our needs assessment that was funded through our preschool development funds.
Well, thank you very much. Actually, one point you made that I want to reiterate, well, one is this, like, more or less this coordination plan serves as the master plan, and you kind of use it in different ways, which I think is really helpful. But the second is really tying in an evaluation with both qualitative and quantitative data, which we're going to kind of get into in a minute. So we'll spend the last few minutes in a little bit more of a discussion across the 3 folks that have shared. Please feel free to, Sierra will let us know if there's any questions in a couple of minutes. Let's see what we do. Okay, we've got about 10 minutes or so. And I'm going to let any of you respond. What did you learn about addressing the barriers and the challenges to coordinating funds? Were there particular barriers or challenges that you faced, and how did you address them? You have to unmute yourself, so you just unmute yourself.
I can give it a start. So I guess I'll be frank, like, the work really is the state, and Lori, I think I heard you say this is the state taking on more of the burden to ease the processes for our local communities. And it's not easy. I mean, we have had a lot of fiscal staff turnover, which across state agencies, and we really have to look for staff who are looking for the yes and happy to like think creatively. And it takes a lot of extra work to try to lay this foundation. And I think once we lay the foundation and once we document it, which we got next, hopefully we make it easier for whoever comes next after us, but it's hard work. But then I also think about some of our grantees, and we are talking about, as the next part of our evaluation, I can name a handful of grantees who get 6 to 8 grants from different state agencies, who have duplicative site visits, reporting, evaluations that they're doing, all of the monitoring, everything. And that's, you know, we need to do better. And so, so it's for a good cause. It's a lot of work.
I think the point you're making is really important because it is a new way of working, particularly for state agency folks in a lot of ways. But if you can break the barrier, and isn't that a wonderful use of federal dollars like this to break a barrier and come up with some new practices and policies? And then administer, that burden at the local level. Can you imagine if you all probably do this too. You talk to people, there's one person that's dedicated to just managing all this dollars. And if you could reduce that, then you could have more people looking at quality and doing quality improvement. So thank you very much. I don't know, Lindsay or Kayla, did you want to add? Did you have a different challenge or barrier that you addressed, or do you want to go to the next question?
I'll just add and say I agree with everything Amanda said. And something that I noticed in this was just how many barriers there are, ones that you didn't even expect. You expected to be rules around funding. What you don't expect is, because every single approval process is different in every single agency, and who has control over which funding streams is so different in different places. It really comes down to having a shared vision and a shared goal, and then figuring out how people can use their various puzzle pieces to achieve that shared vision and goal. And if you don't have that to start, then it's kind of an exercise without a purpose. And so it has to start with what you're trying to do and then take the resources available. But it is incredible how many barriers there are, and a lot of respect for everyone doing it across the country and at the community level who are doing the braiding and blending, because oftentimes states are not taking on that effort. And so I think there's a lot of that we can learn about how to make it easier for our community partners by doing this at the state level.
It almost would be a great follow-up brief to identify those barriers, and kind of how you work that through and elevate that to some of the state agency folks, which I'm sure they kind of know about it, but don't really, it's not presenting and, how it's really impacting the services. So thanks so much. I appreciate that. Lindsay, do you want to add, or you want to go to the next question?
I think they covered it. I think the biggest thing for us was just trying to bring the right people at the table to remove some of those barriers, just because whether it's internally our state agency or statewide, we just had to make sure that people who needed the support were getting it, and trying to be thoughtful in that approach without duplicating everything that's already happened.
I loved what Amanda said about getting those people who will say, go to the yes or something like that, even just being willing to work through what the barriers are. But we don't have too much time, and I know Kayla has to jump off right at the end, but I think it'd be really helpful to talk about the results you documented. I know some of you already gave a couple of examples, but if you could, provide a little bit more detail about what was the result you were documenting. Was it about more people served, maybe efficiency of staff? I don't know. What were the kinds of things you were looking to document?
I'm happy to start quickly. When thinking about pre-K, one of our barriers had been that to prevent displacement of children as new pre-K sites opened, we would not allow someone to take an existing classroom and turn it into a Rhode Island pre-K classroom, because we didn't want to see infant toddler care or existing care be displaced. However, that meant that we weren't necessarily investing in rooms that already existed, that were already serving children and needed the investment to improve quality. So the new funding models, which I did put the link in hopefully it reaches everyone.
Yeah, and it's in the paper also, just so you know.
Fantastic. So the funding models allowed us to take that into account and allow more folks to apply to become Rhode Island pre-K providers. So a key metric for us was how many rooms that would not have been eligible previously, but met all of our criteria for the program, were now able to come into the system. And so our ability to reach and expand in a cost-effective manner, leveraging all of the different funds already in the system, was one of our key metrics.
That's fantastic, right? That's kind of what we're going for. That's the purpose in a way, to really to ensure we're using what we have. If we're not going to get new dollars, we're using what we have well. Others want to talk about what results you documented and what kind of data you collected.
I covered some of it earlier, but we kind of went from like the ground up. And so we collected data from like all the way from families up to the top in terms of from a system level to be able to report on not only what our programs needed, but then also what's already existing and how do we utilize. For example, we're integrating our Eclipse program, which is our interventions and prevention services, with our early ECAP program to help utilize some of those resources as well.
Great. I noticed there is a couple hands raised or chats or questions. So I'm going to have Amanda respond, because I do think talking about how you documented and what were the results you were really looking for is really helpful. And then we'll open up for questions.
So I think our sustainability guide is a good example of how we have a really strong, thorough document that goes through all those sustainability levers, crossed with every single project we have with the preschool development grant, including the coordinating of funds. And it has led to a number of, this gets a bit to the next question about sustainability, but it has better suited us for legislative asks, at least in 2022, and we'll see what the governor's budget is this year. And then the other thing I think, because this has been so challenging, is we've done really thorough documentation of how we've braided funds, and we have our evaluator focusing on a guide, more not necessarily braiding funds, but just cross-agency finances. What are the contracting tools we do? The hope is that it provides a roadmap for someone else to do this type of work. I will say we've joked of, if someone reads this, will think, like, why would I do this? So we're trying to make it more inspiring than daunting.
I'll say, yeah, thank you, but no, thank you. Right. Sounds good. Sierra, I'll turn it to you to see if there's any questions you want us to answer right now. Kayla, while she's doing that, I know you have, is there anything else you want to say about how your state is thinking about the sustainability of efforts? I know you're working on some of that and about to go work on that a little bit more for the pre-K program.
Yeah, I thank you so much for this. And I think the brief is a really helpful list of all of the levers that are available. And one thing I think about is, this is a field that we know we need more investment in across the board, and we can't cost effective our way out of the issues that we have. But I do think it is helpful when we go to talk about more investment that we demonstrate that we've taken every single step possible to be as creative as possible in braiding and blending and leveraging and layering funds. So that way, when we're asking for more, we're demonstrating that we can do it well, we can use the funding well, and that we've really tried everything possible. So I think that is a helpful place to start, but certainly there's no magical solution here. And it really is that more investment is a lot of the answer.
Thank you that's a perfect, actually, kind of concluding or wrapping up remark. I think that is really important, but it is true. In order to ask for more money, you have to show that you're using what you have well, and you're not wasting more or less by creating. So that's terrific. Sierra, thank you, Kayla. And if you have to drop off, I do understand. We understand she has to go to a budget hearing. We're going to stay on a few more minutes just to see if we can check any other see if there's any questions, and I want Amanda and Lindsay to just, have a minute to conclude as well. Anything else you're thinking about? But Sierra, are there any questions we should answer?
Yeah, there's 2 questions in the chat. The first one is curious whether any states layer Head Start / early Head Start funding with state pre-K or infant toddler programs.
If the states want to, I think Lindsay mentioned that you do.
Yes, we do. Our early ECAP program is essentially our state version of early Head Start, and a lot of our contractors do serve both children in their classrooms.
That particular issue wasn't, I mean, whether they layered it with Head Start wasn't a particular focus of this brief, whoever was answering that question, but we know that that is a strategy that a number of states use, you know, and a number of state pre-K programs are basically follow the Head Start model, like Delaware and Washington and I think Oregon as well. So I think that is definitely, and in early Head Start, there is an explicit focus and set of supports around layering. So it's definitely a good model. I don't know, Amanda, did you want to add any more around that? No. Okay, the second question, Sierra?
Do these funding policy options apply to IDEA funds for transitioning high school years? If you can give a scenario, please.
That's not anything I'm able to actually answer. That is not something I studied regarding IDEA funds. So I'm sorry, I'm not able to do so. I would suggest looking at the Early Childhood Technical Assistance Center website and seeing if there's anything there that talks about it. But that wasn't a focus of my work, and I haven't actually heard of that, honestly, because I mostly focus on early childhood. There was somebody that had a hand raised, and I can't actually get to it, but did everybody get their questions answered that we could answer right now?
I think the person that had their hand raised dropped off already.
All right. Well, I want to thank Lindsay and Amanda and of course Kayla for being with us this afternoon. We're going to conclude in another minute, but I just wanted to see if Lindsay or Amanda, I mean, Amanda, you kind of talked about how you're thinking about sustainability planning. Lindsay, do you want to say anything about how Washington State is planning for sustainability?
Yeah, I think how we're planning on for sustainability is our evaluation, our PDG evaluation team is doing some amazing work to show the progress of a lot of our projects. And then we're tapping into local and state resources. We have several programs that are within our decision packages to our legislature. And so we have a lot of support too. So that's kind of where we are, but I am jealous of your sustainability plan. It sounds amazing.
Thank you. Thank you each very, very much. And I know that you all are working hard every day, so really appreciate you being willing to come on the call and to serve as an inspiration to others. It is hard, but it is possible. Here's some additional resources we have on the PDGB5 website. There are some real toolkits around, you know, the mechanics, if you will, of blending and braiding. I think it is a really important topic and an important strategy within your thinking about strategic financing, in addition to new money, how we use what we have well. So thank you to everybody who joined us today, and we really look forward to hearing more from you about the great things you're doing in your state. So have a great afternoon and happy Thanksgiving, everybody. Bye.